Hi everyone, this is Julie from Totally Holistic Health, and today I'm going to talk to you about a really good technique. It's a slightly different technique than I've talked about before, as it's probably not quite straightforward, but it's a really useful technique, and it's based on kinesiology practices. It's called temporal tapping, and what it actually does, it actually reprograms the brain. Now it doesn't do something, it doesn't overrule the brain, so it's not a case of we're not trying to sort of force it to do something it doesn't want to do. But if you have certain things like, wanting to stop smoking, or maybe have a fear of flying, it's a way of almost reprogramming the brain so it doesn't actually have that fear. Now the main things we need, basically what we're trying to do is we're actually going to tap a positive statement around one side of the ear. This is the temporal area around the ear. So we actually have to tap in a positive statement around the left side of your ear, and then around the right side of the ear you need to tap in a positive negative, which sounds a bit bizarre. So if it was something like a fear of flying, maybe you would think, I enjoy flying, which you would tap around the left side of the body. And then if it's a positive negative, it would be something, I have no fear of flying. And if it was something like overeating, it would be I'm happy eating healthily. And if it was your positive negative, it would be something like I don't want to eat unhealthily. So they're sort of similar phrases, but they're slightly different. You're actually tapping in on different sides of the brain. Now, unfortunately, my camera is actually the other way around, so this is actually my left side, which obviously for the camera is actually your right. But if it was, say, for example, for the overeating, so what you would do around the left side of your ear, you would tap something like I will control my appetite and not overeat, something like that. And then on the right hand side you would go, I don't want to overeat. So they are very similar phrases, but you would just keep saying it over and over again. So on the left hand side, I will control my appetite and not overeat. And this saying, I don't want to overeat. Okay. Now the actual phrase is quite important. It would be something that you would really seriously need to consider, because it can actually have the opposite effect. Because if the phrase is wrong, it actually causes the body stress, and it can actually make the problem worse. So it would be something you would need to tinker with. When I'm actually working with a client with kinesiology, I would normally muscle test them to actually make sure that phrase isn't causing them too much stress before we actually tapped in the right one. So it'd obviously have to be something that you were happy with and maybe had to work with. But obviously that's where kinesiology comes in, because it's a very useful technique, because we can actually identify what the actual wording would actually be. But it's also very useful if you're confident that you can try it yourself. It works really well. So if it's something like smoking, you could say I am happy being a non-smoker. So again, you would tap that around your left side. I am happy being a non-smoker. Just keep doing it a few times and saying it a few times. And then on the right side, you would tap in something like, I don't want to smoke. I don't want to smoke. So you just do those. I mean, the more you do it, you'll probably know in about 2 days whether you're actually that phrase is actually causing you stress, because it would actually have the reverse effect. But then you can also alter it as well, or obviously speak to a qualified kinesiologist as well, such as myself, or anybody else, or I can give you some details of kinesiologists that live nearby you, if you're looking to achieve that this way. It's a really useful technique. It's non-invasive. It's very specific to you as well. So it's not a kinesiology itself is not a treatment that is. It's a very individual treatment, because everybody has different symptoms and different causes of the problem. We actually treat the cause, not the symptom. So if you want any more information, let me know. Let me know how you get on. I'd be interested to hear your comments and see whether it's actually working for you. Obviously, if it doesn't work for you, and then we can maybe sort of have a quick word and sort of get the right phrase for you as well. So good luck. Have a lovely weekend, and I'll speak to you again soon. Bye bye.